Today I'm going to show you how to do CPR. So the basics of CPR is it's something you do when your dog is unconscious and not breathing. It's to restart their heart and their breathing. So first, you want to get your dog on their right side. Chloe's going to demonstrate for me. So I need her on her right side. Good girl. Good girl. Oh, I know. Good girl. There she is. So she's on her right, her left is up. Now I'm going to check for a pulse. You do that in the pulmonary vein, not the pulmonary, in the femoral vein, which runs through their leg. So I take this little lobster claw, sort of go like this, and I'm gonna go straight in. My thumb goes on top of her thigh, my fingers go on the inside, and if you feel around in there for a little bit, you should be able to feel her pulse. There, I've got it. Then 1, 2, 3, 4, 5, 6. So I can feel her pulse in there. She has one. If she didn't, I would continue. Now I'm also going to check for breathing. So I'm just going to watch and see her chest rise and fall. So right about here, you can see it going up, down, up, down. She's smelling, so it's sort of up, down. Now, if she weren't, then I would continue and I would check for any obstructions in her throat or mouth. So you want to leave her where she's at and get on her level. So that means I've got to get over here and I would look in her mouth. Oh, I don't have to now, but yes, I would open her mouth and pull out her tongue. And if I were going to do breaths, I would do them down here on her level. So I'm gonna have to get all the way down and blow like this. I'm sorry, girl. You don't want to bring her up to you. So you don't want to grab her head and pull her up to you. You wanna get down on their level. So that is it on sort of the setup for what we're gonna be doing. If and when you do need to give her breaths, I can show you from this position. Good girl. You're not going to be able to blow in her mouth. It's just not going to work. So we're going to close her mouth and we're going to blow in her nose. So make sure that all of her lips are down. Good girl, like this. And then I blow in her mouth. I'm not going to do it though. When you give breaths, you want to blow about twice as hard as a normal breath. And you'll do 3 to 5 and watch for their chest rising and falling. You don't want to overinflate the lungs, so watch for that. Then you'll take a break and you'll do compressions. So you'll do about 1 set of breaths and compressions and you'll repeat that for a minute. There's our breath talk. Next we go to compressions. Where are we going to do the compressions? So we've already got her on her right side. Then, once she's all the way down, good girl, thank you. I need to figure out where in this general area am I going to do compressions. So I'm going to take her foot, move it up here, and I'm going to see where her elbow is, right here. Move her foot back out of the way, and this is where I'm going to do compressions, right where her elbow hit. So you're going to do about 10 to 15 compressions at a time, which will work out to about 100 per minute. It's pretty similar to the way you do it with people. You want to go straight down, not in a great position for this, but I want to go straight down, and you want to go, of course, hard enough, but not too hard. So for large to medium dogs, that means you're moving down about 1 to 3 inches. For small dogs, you might just use 2 fingers, or they might be so small that you do sort of a taco method. You hold them like this and you squeeze them this way if you've got a really itty bitty guy. After a minute of doing compressions and breaths, so you do a couple sets of each, then you stop and observe, see if their condition has improved at all. And if not, then you can keep going up to about 20 minutes. Of course, this is not alternative to vet intervention, so someone should be doing this while the emergency vet is on their way or while someone's bringing the car around. But those are the basics, and Chloe was so good demonstrating for you. If you've got questions, let me know. I can point you towards more information on this subject. I do have a poster on it with some basic info. It's always a good idea to know your dog's resting heart rate and resting breaths per minute. So I recommend that, you know, once you learn about this, you watch your dog for a while when they're resting and take their pulse, get a baseline so that you know what's normal and not normal for your dog. All right, thank you for watching. You're free. Fine.